Where was the longest place that you lived somewhere?
Ohio.
In Ohio? Are you an Ohio State fan?
Watch out now. Let's go, Boogie. Let's ride.
I don't know about that, because I'm a big Michigan fan.
Ooh, watch out. We're going to ride. We're going to
I don't think I can do that.
No, just play.
How long did you live in Ohio?
Most of my life.
Most of your life? Okay.
What brought you to Detroit?
Change.
I want to ask you just a couple.
Yes.
I know
Do you have any
I don't
opening
want to
in
ask
your
you too many
skin here
questions,
and
but I just
there?
want to be able to.
Do you have any
work
bruise or
properly.
blister, or look at that?
You mentioned that you've been having issues like falling when standing.
All right, so we'll get this. You have insurance?
Diabetic,
Not for
okay.
sure. I think so.
Okay, so we'll get the antibiotic from the pharmacy.
Remember what the diabetes medication?
Right.
Well, before I have been homeless, and I never will again.
Sorry.
It's okay.
Chris, what's on your shirt?
Do we have another one?
You got some leaking there.
Sorry.
Yeah.
So I just answered an ad in the paper, in the Detroit Free Press. They were advertising for this job. I didn't know anything really about homeless health care or anything, and then discovered what a cool job it is.
There are a couple agencies out there that specialize in donating meds to free clinics, and they'll post a list of the medications that they have available, and these are what they're called near dated, meaning they're about ready to expire, so pharmacies don't want them. Medications that people aren't using anymore, like my Uncle Harry died and he had all this medication, so they donate to us and we'll use it. Fortunately now with the Affordable Care Act, most people are insured, so I can get a lot of medications just under people's insurance. Truthfully, the most unreliable part of the whole system is me, because I have to keep in mind what inventory I have and where the gaps are.
Dean was very humble. He was very humble. And he was a hero to us, but to him, he was just being him.
First, I was just practicing here in the clinic and in the center, and kind of had it in the back of my mind about what about the people who don't come into the center? What sort of pathology was out there lingering? These relatively minor conditions that could be easily managed go untreated until it's catastrophic. What does he need? What sort of...
He needs those underwear, those thermals really bad.
Does he have any health concerns? Does he take medication? Gentleman who had come here to the center and was looking for housing. He was very frail, thin, had a bad cough. So we sent him to the hospital. We took him up to the emergency room. But what happens frequently is he was not treated with respect while he was there and left against medical advice that night. So we made arrangements to get him admitted to Karmanos Cancer Center. They wanted a $100 facilities fee, and the students raised the money themselves to get him admitted. That was on a Friday. He was going to be admitted Monday. He got worse over the weekend, went back into the hospital, and then died that Sunday.
Thank you, my Father God, the Most High, most glorious, most magnificent to you.
Dean's passing really affected all of us. I'm one of the people that it really impacted.
I've known Dean for quite a while. I actually was a resident of the Tamani Center, being homeless myself. For for 4 years. One day I was sick. I think I had close to pneumonia. Found out I had asthma and bronchitis at the same time because Dean put me in his car and actually drove me to the emergency room. Probably saved my life that day. I was really sick. That was when I was in my addiction. With the support of people like Dean and another gentleman I work with, they encouraged me, and so I was able to get back on my feet. And I've been here ever since. And I'm still being supported and still being groomed. And I've learned a lot here. So that's how me and Dean wind up working together.
Here's your chocolate.
Simple things to us, like, clean socks, means a lot to people who are out on the street, and they're very grateful for it. How you doing?
How you doing?
With street medicine? Medical student volunteers?
Okay.
Do you have any medical condition? Any health concerns?
Are you interested in the housing?
He's on the edge. The best we could hope really is just repeated encounters will kind of wear down his reluctance to get services and get him into housing. Success.
Detroit has really changed over the last few years. It's been a lot of expansion, a lot of building up. The Tamani Center left, and people had to find other resources. I remember I started attending groups here. I used to just go in the group for milk and cookies at first. And I started hearing some things that made sense to me. And I kept coming back. The Tamani Center saved a lot of lives. I had a range of emotions. One was, oh no, it's gone. The safety net is gone.
Nurses are patient advocates. I find most nurses, not all, but most nurses are not judgmental. Dean was an excellent nurse, and I know I'm biased. We met at the VA Medical Center in Ann Arbor. He was very spontaneous, always very curious about things, curious about nature, curious about life. He had graduated from high school and went to Michigan Tech in the UP. Initially, he was going there because he wanted to do pre-med, but that really wasn't clicking with him at the time, and he just didn't know what he wanted to do. So he decided that he was going to join the Navy. Being young and just wanting to do something different, wanted to explore the world and see what was out there. And he would frequently get asked how come he didn't go to medical school, and he said if he was a doctor, he could not spend as much time with his patients. He was a very introverted, shy person underneath it all, but he did have just a real knack at just putting people at ease. He suffered from depression, and a lot of people, I think, didn't know that. But I think that's one of the reasons why he related so well to his patients. It was unexpected. We were up north at our family cabin. It was essentially his heart. He went to bed and just didn't wake up the next morning. His long-term dream was to open a respite center in Detroit. When he would visit other cities, when he would go to conferences, he said one of the things he noticed is that there would be a center for homeless people to go to after they were discharged from a hospital. So Detroit didn't have that, and so that was Dean's kind of long-term goal, was to open something like that in Detroit.
Cleaning out the room.
Oh, okay.
We found all of these.
Wow.
But we found some more. But we need you to look at it and see if it's any good.
All right.
Okay?
Thanks.
But we found all of those in drawers. Okay?
Thank you so much.
At least for the shoulder, he says it's not currently bothering him. He doesn't have any pain on motion.
Oh, good.
He's able to lift the shoulder. He's still using it.
It was easy.
But there still is quite a bit of that warm, personal, handoff. Oops.
Okay.
Sorry. Hello? Okay. Okay, great. All right. Thank you, sir. I appreciate it.
Who was that?
That's Mike from the Midtown Pharmacy. He's really good.
I guess, how did you learn to kind of work this charity system
No,
and
it's-
find these people?
It's an ongoing process. It's happening all the time.